Welcome back. Well, this weekend we turn the calendar page over to October.
And October's Breast Cancer Awareness Month. Dr. Kristen Zarfos is a breast cancer survivor and director of the Hospital of Central Connecticut's Comprehensive Breast Health Center.
And joining her also is Lori Van Dam, the CEO of Komen for Southern New England. Welcome to both of you.
Thank you.
It's an important time that we have Breast Cancer Awareness Month because so many of us are touched by it, and yet we're always astounded how little we know. So we have some true and false questions that we really want to get out there to make sure that people are understanding the issue.
Great.
All right, let's take a look. Number one.
So number one is women who are in their 70s and 80s no longer need to have mammograms because they do not develop breast cancer often. What do you think, Scott?
I'm going to say no.
I'm going to say no. False.
False.
So the highest number of women with breast cancer are women in their 70s and 80s. And so women should continue to get their mammograms, have their breast exams.
1 year? Every year? Once a year?
Well, there's controversy about that, but
okay.
I encourage women to be proactive in their health. They should look at the risk, right? The family history and other characteristics. But in America today, just like eating healthy food that you saw earlier today, women should be proactive in their health.
Okay. Excellent. All right, question number two, true or false? All breast cancers are found on mammograms. I know the answer to this one.
False.
Yeah.
Well done.
Yeah,
mammograms are a very imperfect tool. So we're actually at Komen funding a lot of research around alternative ways of screening, and in particular, women with dense breasts. Very frequently, it's difficult to find cancers in those breasts, so we need alternative and additional screenings.
Okay.
And the most important message, if you have a lump in your breast and your mammogram is normal, don't stop there.
Go and say,
physician, nurse practitioner, physician's assistant, and have it checked out.
okay, absolutely.
And I think women, are the caretakers for everything, and they're like, they tend to disregard their health more than men, and that should not be the case.
Right.
Take care of yourself first.
Best way we can take care of other people is to be healthy.
Yeah.
Okay.
So next, for true or false question, avoiding obesity as women age, exercising 4 hours a week, avoiding tobacco use in younger aged women, and limiting alcohol intake can decrease the possibility of developing breast cancer. I'm going to say true.
True.
Well done. Yes, absolutely, it is true. It's part of a healthy lifestyle that's going to affect your risk for lots of different medical issues, but in particular breast cancer. And actually, we are co-funding some research up at the Dana-Farber with a doctor named Jennifer Ligabell and Fitbit to try and see if reducing weight after an initial diagnosis will help prevent recurrence. So lifestyle factors are very, very important for breast cancer.
Isn't that incredible? Okay. True or false? And question number 4, if there are no family members with breast cancer, I already know the answer to this one, then it is unlikely that a woman will develop breast cancer. False.
So 70 to 85% of women diagnosed with breast cancer have no family members with
That many, huh?
And you know what? Women will come in and say, why do I have breast cancer? Nobody in my family has it.
Right.
So while it's important for us to let people know that if you have a family member, you're at increased risk, it's also important to know, again, if you find a lump or have an abnormality on your mammogram, because there are no family members, don't let that be a barrier to seeking care.
Okay. True or false, if a woman has breast cancer, having a mastectomy will guarantee her that her cancer will not recur.
So,
false.
It is false,
yeah.
Yes. And as a surgeon, I can tell you, I wish when women have to have mastectomies, I could guarantee that the cancer won't come back. But there's a lot of studies that show that when women meet the criteria, having a lumpectomy and radiation has the same chance of the cancer coming back, 5 to 7%.
Really? Okay. Now we need to talk about, this is the answer to false. So if your breast is dense or not. So this is a fatty breast. Is this the opposite of dense? And this is a dense breast. And then we have another one of a very dense breast. So those are the different kinds of breasts you could have. And as far as finding breast cancer, what would be the easiest one?
Fatty. And a tendency is for, as women become older, the breast tissue atrophies or it decreases, and so your mammogram will look black, which is great because cancers look white on a mammogram, so in a black background. But if you have dense tissue, it's like driving in a fog or a snowstorm, the white cancer is obscured. Komen's done a lot on this issue.
Okay.
Yeah, it's something that we really think is important, and the first step is obviously the legislation that was pioneered here in Connecticut to say that you need to be informed whether or not you have dense breast tissue, which is now required by law in 27 states. But in addition, of course, the next question is, well, what are you supposed to do about it? And that's where it's really important to have a conversation with your physician to figure out what the next screening is for you. Could be a screening ultrasound, could be an MRI, and we're also also looking at other modalities to try and come to better understanding of what's happening inside the dense breast.
There's so much information about this, like, especially with new technology. Is 3D better? Should we be asking for that? Or sometimes traditional is just fine?
Well, in women who have dense breasts, there are studies that suggest that 3D is preferable to digital mammogram. But digital mammogram and ultrasound, which is the standard now until all facilities get the digital, is good. And I don't know we'll ever see studies that compare the two. But digital's been a good standard. You're going to see 3D everywhere, don't you think?
Mm-hmm. Eventually, I think so, yeah.
I just want to say one thing, though. One doesn't know the density of their breast unless they have a mammogram. And if you're an underserved, a woman who's underserved, thanks to Komen providing free mammograms, then those women will be able to know what their density is and then go on to have a discussion with their physicians about screening ultrasounds.
Can we just reiterate again age or approximate age and how often women should go to get their mammograms?
Depends on which guideline you're following.
Okay.
So that's why we really recommend a conversation with your doctor. And again, you have to assess your personal risk. There are some women who should be having regular mammograms at 35. Many standards say 50. We very much agree that it's important for women to advocate for their own health. And to me personally, I'd rather have a false negative than miss a positive.
Right.
Well, thank you, ladies, for being here. Very good information. We appreciate that.
Pleasure.